Hello everyone. Today we are going to discuss about the essential document which is required after the clinical trials. The essential document is defined under the GCP E6 guidelines. In that, the essential document should be maintained throughout the entire life cycle of the clinical trials, which is including the planning, conduct, and the reporting phase of these clinical trials. So this document should be filed with an organized manner to facilitate the management of the trials, audit, and the inspection, and should be maintained throughout the life of the trials. And it should be confidentiality and protection against the loss or the damage of the participant or the clinical trials. The E6 guidelines allow for the essential document to be maintained in a both format, that is in a paper format and the electronically, and also the combination of this both, so it can be made easily available to inspector upon the request. Now we are seeing the documents which are required after the clinical trials. In that, the once a trial is completed, additional documents need to be added to the TMF to complete it. First document we are seeing, that is the IP accountability and the destruction. In that, the it includes the full accountability of all the drugs which is displayed or dispatched to the site and dispensed to the subjects, and those to be written at the trial completion and followed by the instruction of the unused drugs either at the site or the centrally, with a certificate of a drug destruction issue. Next document is a sample destruction. In that, the sample and the tissues collected during the trial must be destroyed, or either a certificate of a destruction issued unless the written for the future research project. Next, third one is audit certificates. The certificates of any audits conducted during the trial must be or also be filled in the TMF, and the formal close-out visit must be conducted with all the outstanding documents, and it is collected from the site. Next document is the IRB notification. In that, the IRB must be informed when the trial is completed, and a copy of IRB notification or the summary report must be submitted. In a comprehensive clinical study report must be produced for all the trials, and even if the trial is terminated prematurely. The list of the above mentioned earlier is not comprehensive and maybe not cover all the required documents for the clinical trials. You can find a comprehensive and exhaustive list of the necessary documents in the International Council for Harmonization, that is ICH guidelines. And for the complete list of the documents that need to be filled at the site level, that is ISF, or the sponsor level, you can go for the various visits and you can find that the documents. It's all about the documents which is required for after conducting the clinical trials. Thank you.